Thank you very much. I forgot to put in my bio where I work. So I'm the Director for Clinical Quality in Cambridge University Hospital's NHS Foundation Trust, just around the corner. So we've heard today a lot about how technology is so potent and so important in driving forward quality and safety. I want to try and give you a slightly different perspective, which is my perspective, I suppose. I want you to look at this picture for a few moments and look at the anguish that is in this picture. This lady is the wife of a very prominent patient safety campaigner in the UK. Unfortunately, the baby, as a newborn baby, is dead. And this is not a typical, but it's an example of a number of patient stories that we hear. I suppose this is one of the worst varieties. This is about preventable harm. And when I look at the other stories and the incidents that we know about preventable harm, we see not only individual errors, but we see system failures. And it's the system failures that are the things that we really need to concentrate on, the design of our systems. And the common factors that I see are communication and teamwork, variation in care, processes not being clearly defined, inconsistent training, poor decision-making, ineffective learning and implementation of change. You can see technology in there, but these are the problems we actually face. And what I'm showing you here is just the tip of the iceberg. We don't know exactly how many incidents of preventable harm are occurring. In the United States, originally, it was supposed to be 10% of patient episodes. But many of you will have experienced preventable harm yourselves or in people you know of one degree or another, hopefully not severe. So there's a lot of it out there, and we need to do something about it. These industries, the so-called high reliability organizations, do not have icebergs because they have ways of managing their safety, which is what I want to talk about today. They are highly dependent on the technology, and they're very innovative in the use of technology, as we've been discussing today. But they have something more. They have a system of operation which has been designed, and they have a system which has been designed using human factors. That means taking into account the fact that people are working with the technology, and they have to design the system, the technology, to work with the people to be used in the most effective way, to make it easy to do the right thing and hard to do it wrong. Their processes are as simple as they can be. They're explicit, they make them explicit, they make sure they're effective, and they make sure that they're standardized so that they can measure them and they can improve them. They engineer them for learning. They remove obstacles to improvement. They make the best use of the resources that they have and balance those against their activity, something which is often very difficult in healthcare, as we know. They focus on their staff, on training them and supporting them so that they are able to do the jobs that they're employed to do. And they measure outcomes relentlessly. They get timely and meaningful information which they use to improve. And they recognize the importance of accountability. What they are doing is they are creating a safety framework. And the safety framework that they create leads to a safety culture, something which is mentioned hundreds of times in the reports of Francis and Berwick, but nobody knows quite how to achieve it. And this is how these industries have achieved it. They've created a systematic approach to safety. Systematization of safety is the first step in an evolutionary process because it designs in safety to the normal business processes of the organization, and it forms the framework on which a safe culture can be built. What they use are called safety management systems. They're mandatory in aviation, the industry that I'm experienced in, and they are also used in the other industries, and we need to have them in healthcare as well. And I'm not going to talk about them today because I haven't got very many minutes left. But what I do want to talk about is I want to talk about the first thing on this list, inspirational and directive leadership. Leadership which is committed, accountable, and visible to everybody. And they have a clearly communicated vision of what they are trying to do, why they are there, and what they're trying to do, and how they're trying to do it. And safety is the number one priority and is understood by everybody in the organization in a systematic way as being the number one priority. If you go into an airline like the one that I worked in, safety runs through everything. Before everything that they do, the first question will be, is it safe? or how is it going to affect our safety? Now, you may be familiar, this is supposed to be a TED-style talk. Many of you will have seen Simon Sinek and his TED talk about the golden circle, the importance of why. In other words, why are we here? What are we trying to do? What is the vision which drives everything else? I think we have talked today quite a lot about the what. In other words, what we use to do that, but not so much about the why. And I'd like to focus a little bit more on the why. So go into your local hospital as an experiment. Go into the hospital, pick 10 members of the staff of the hospital and ask them these questions. What is your organization's mission? What is the organization's strategy for achieving it? See if you get at least safety among those as the priorities. Who are the leaders of your organization? Do you know who they are? And when did you last see them? And where did you see them? Were they in their office or were they with you? I think these are quite important things as a sort of test of the culture of the organization. And I think different organizations, as we all know, will fare differently. So my message today is hopefully simple. Technology is very important in improving and sustaining and developing safety in healthcare. It makes things faster, it makes things easier, it makes things more effective, it makes things safer. It allows us to do things that we haven't done before. It is key to improving safety. Process design is also extremely important. We need to look at things like lean systems and all the things that we can do to make our processes more effective. But none of this will happen without leadership, and leadership that understands that safety has to be put first, that safety has to be embedded in everything that we do. And that is what ultimately drives safety in industry, effectively. So have a look at this list again of what I see as the fundamental problems that lead to our avoidable harm. And you can see that there is a place for technology in there, but we need something substantially more than that. Thank you.
Thank you, Nick. Thank you very much.